everybody. Obviously, I'm Harvey Shiffman. I'm a general dentist in South Florida. I've been using hard and soft tissue lasers for a little over 12 years now. And the Lightwalker and the Lightwalker family of lasers for about 6. So that's my background. About 2.5 years ago, we were approached through Fatona in South America to start presenting and using the Nightlase procedure in the United States. We were actually the first ones to use it in the United States, and we developed a training protocol for it, and we helped develop the entire procedure that's called Smooth-Lase also. There was a procedure being done in South America and Europe called Smooth Lip, or not having a name at all, and we basically named it and expanded it to the full face area. So we basically treat from the infraorbital area, to the angle of the mandible. So depending on the vestibule of the patient, but we'll get a little bit into that as we go. Okay, there we go. So basically the history of these procedures, the development was done in South America in the mid-2000s. I think it probably started about 2006, and it was originally developed to use for treatment for urinary incontinence, the erbium YAG laser. And they found through treatment that they were getting other results with it too, and then they developed a secondary procedure for vaginal rejuvenation. So there were several South American physicians that were involved. Luis Mancia, who is actually Adrian Gaspar, who is a gynecologist, and David Grinstein, who is an ENT specialist. And it was actually first used for the treatment of snoring in 2010. And like I mentioned previously, we developed the protocol for the training in I think January of 2013. So we've got quite a number of cases behind us, and the results have been very good so far. So basically, the most up-to-date treatment involves something called smooth mode. And Dr. Jones, do you own a laser at this point?
Yes, I have an NV-YAG and I have a diode laser.
Okay, all right. This gives me an idea of where we're coming from with this. So what smooth mode does is it uses the erbium YAG laser, which is used for hard and soft tissue, and it stacks up the pulses so that we get a deeper heat penetration into the tissue without causing any ablation, without removing any tissue. And the pulses are longer than the tissue recovery time, so that heat does penetrate. And we'll explain, exactly what that penetration does. Basically, everybody can see the slides, correct?
Yes.
Okay.
Yes.
So the smooth mode stacks up 6 pulses of the erbium YAG laser in about 1.5 seconds. So as each pulse goes from 1 to 6, the heat penetrates deeper into the tissue, as you can see in the photo that's there. Okay, so at the 6th pulse, we get significantly more heat generation deeper into the tissue as that 6 pulses goes on. So just basically, what Nightlase is, it's a non-ablative treatment, which means that no tissue is removed. It's a tightening and elevation of the soft palate, the uvula, and the surrounding tissues, okay, which are all related to snoring and obstructive sleep apnea that block the airway. There's no anesthetic needed, no needles, no topical anesthetic. There's no intraoperative or postoperative pain. There's a little error in the slide there, I just noticed. So it's intraoperative or post-op pain. The patients really don't feel anything except for some warmth. And it consists of 3 20-minute sessions over a 9-week period. So in between each session, there's 3 weeks time. Now the reason for the 3-week time period is for the regeneration of the collagen fibers, which causes everything to tighten up. So collagen will regenerate after treatment up to 30 days altogether. But we come back in after 21 days to repeat the treatment just to intensify the amount of shrinkage that we get. So typically what we'll see after the first treatment is about a 50% reduction in the volume and tone of snoring. And obviously this whole procedure has been optimized for the, for the Photona Lightwalker laser family. Now, people say, what if I just do one treatment, that type of thing. What happens if you just do one treatment, then the longevity of the treatment is diminished significantly. So whenever we present treatment to a patient, we present it as an entire package of the 3 treatments, the introductory examination, and the follow-up, all in the same treatment plan. Any questions so far? Everybody good? Okay. So what's very, very important is it's a certain percentage of people will present to the office or be brought in by their sleep partner or significant other, whoever that may be, because of snoring that's disrupting the sleep partner or the family or the neighbor's sleep. So we're medically responsible to screen somewhat to see whether the patient has obstructive sleep apnea or any other sleep disorder before let's treat them. Now, we do that when we do the courses, the complete courses. We do a significant introduction to sleep medicine, dental sleep medicine. Has anybody taken any courses in sleep dentistry, sleep medicine?
Yes, I have.
Okay, all right. So basically, you've got to screen the patients to see, what their issues are, if they need to be referred to a specialist for a sleep study, or if they have, ENT issues. So that's very important that be done initially before treatment to make that decision, and we'll show you the steps that we go through. Now, Nightlase is also an alternative for patients who either refuse to use CPAP or oral appliances or can't tolerate them. And we always recommend follow-up sleep studies for patients that have tested positive for obstructive sleep apnea. And we definitely recommend, additional training above and beyond, what the Nightlase course offers, even though it's significant. So basically, this is our oral cavity, and so the uvula, the soft palate, the palatine tonsil areas are the areas of our concern that we direct our treatment to. And then indirectly, some of the laser energy is going to go back to the tonsils themselves and the oral pharynx, even though they're not in our zone, so to speak. So the reason why Nightlase works. So Nightlase is a thermally mediated, which means it uses the heat from the erbium YAG laser, and we get what's called a heat shock in the tissue, which causes the collagen fibers to contract and convert them from type 3 collagen to a type 1 collagen, which is more elastic and more tightly wound. Okay? So basically the improvement that we see in the snoring and obstructive sleep apnea is based on the fact that we get that tightening and the airway opens up. And you can actually see it during the treatment, that the soft palate and the uvula will elevate, as we continue on with treatment. So for some patients, we'll start on the left side, treat the entire left side, and show them that side has raised up and opened up, and then we go to the right side and continue, especially in the beginning so they get used to seeing that. So, we've gone through research reviews, and numerous lasers have been used over time to try and get collagen tightening in tissue. And the erbium YAG laser was shown to have the longest lasting collagen tightening, and also shows no scarring whatsoever compared to either surgical interventions, radio frequency treatment, or other types of laser treatment such as ND-YAG or CO2 lasers, which can cause scarring in the tissue. So there is no scarring in the tissue with this procedure. So again, it's very gentle. It's considered non-ablative, so it does not damage or remove tissue. So it's our feeling, our entire body is interconnected, and our organs and muscles are covered with fascial tissue, which is a very dense web of collagen. So the collagen covers, the soft palate, the uvula, and all the related structures. So it's our feeling that the laser interacts with the collagen, the fascia, and that's where we're getting our tightening from. So when we originally got trained back in 2013, we did an initial pilot study, a clinical study that we performed in our office. So because we wanted to see, how does this work, how long is it going to last, and how the patient responses were going to be. There was research that was done in Eastern Europe, but there was none done in the United States at all at that time. And there's several research projects going on now in different areas of the United States. So we took 12 patients from our patient pool arbitrarily. We did 3 treatments. At that time, the treatments were done 14 days apart. And then 2 weeks after that was completed, we did follow-ups, and then follow-ups at 6 months, 12 months, and 18 months. And the 18-month data is still being collated. We have some laggers in the group. So with that group of 12, we showed 20 to 90% improvement in their snoring, both in tone and volume. And this clinical study that we did only addressed snoring because we had limited equipment at the time, and we figured we would start out simply and then move to more complicated studies after that. So we've got one with sleep apnea going now, actually. Now this graph shows the snoring change before and after for the 12 patients that were in our group. The befores are the blue columns and the afters are the red. So you can see there was a significant reduction all across the board with the 12 patients that we used. The variation in the patients was based on several factors, which we were able to come to after the fact. Let's see, hold on a second. Okay, go back. Sorry about that. So basically the patients that had the lowest amount of improvement from before and after, there were 2 patients that were fairly heavy smokers. There was 1 obese patient and 1 patient with moderate to severe sleep apnea. So typically those are the type of patients when we do our case selections, we want to try and avoid because the results are not as good with those patients. So typically you're going to try and avoid the significantly grossly obese patients. Again, smokers do not respond as well because their tissue tends to be more fibrotic from the smoking. And moderate to severe sleep apnea does not respond as well. Okay, the studies that were done in Europe and Eastern Europe were involved with sleep centers where the patients went through full polysomnograph, overnight sleep testing with a full set of leads and decibel level controls and all that. So and their results were pretty consistent with what we were seeing in this clinical study with the percentages. Any questions so far? Everybody good?
Yeah.
Okay. All right. We're going to move on. Okay. So this is a before and after CT scan. They're colorized volumetric CT scans, and they were taken on one of the patients of one of the doctors that I had trained. The before is on the left, and the after is on the right. So with the volumetric analysis, the upper airway improved by 50% in volume. Okay. If you see the middle area, the orange, and there's a little red line across it. I wish I had a pointer that I could use here. But the measurement from left to right on that red line, right where the lower notation is, that's kind of hard to read. That measurement is exactly the same in those 2 areas. So the area above that, which is the upper airway, improved by 50% after Nightlase treatment. So with all our patients now, we're doing the CT scans, the ones that we have in our research project presently. And we've got some pharyngometer results here, also showing significant improvements. This patient started out at, can you see my cursor?
Yes.
You can see it? Okay, good. All right. Started at 36%. I'm not real good with these screens, so I'll just give you the breakdown on that. Started at 36%, and this was his after at 97%. All right, so there's over a 60% improvement in his volume after Nightlase treatment. Now, we also recently got some results on children. Not much has been done with children. We're just beginning now to be treating children and collecting data. With children, typically we'll evaluate them, send them to an ENT for evaluation of tonsils and adenoids first, and possibly combine Nightlase with craniofacial treatment in order to help them grow their airway, to open up their airway and try and eliminate habits. So there is a place with children and Nightlase also. Now this slide is our decision tree. So basically, off to the left, the patient presents. Either they come in on their own, their sleep partner, significant other brings them in. Sometimes it's neighbors that tell them that they got to come in or they got to move. So if they've got significant snoring issues. So we use screening questionnaires, and if we get positive responses to the screening questionnaires, then we'll refer them to a physician for a sleep study or ENT evaluation. If the screening documents get negative responses, then we don't have to refer them out. We just obviously keep record of all these forms that we use, and we can go directly to Nightlase treatment for those patients because they don't have any significant issues that would be related to obstructive sleep apnea or any other sleep disturbances, related sleep disturbances. So if they go to the sleep physician and they get a study done and they come back with a diagnosis of mild to moderate obstructive sleep apnea, they have options of either mandibular advancement appliance, Nightlase, or co-therapy. A co-therapy would be a combination of a mandibular advancement appliance and the Nightlase. The benefit to this is that they don't have to be titrated, or the lower jaw does not have to be moved as far forward as it would without the Nightlase. So the patients are more comfortable. There's less occlusal changes related to that. So that works really well. Now, if they have a diagnosis of moderate to severe sleep apnea, which is the next box down, so typically the gold standard would be CPAP. If the patient can't tolerate the CPAP, so they have an option of either using Nightlase with the CPAP to use lower pressures in the CPAP machine, or a combination of a mandibular advancement appliance and Nightlase. So that's basically how we decide which direction the patient's treatment goes in. So any questions on that so far?
No.
Everybody good? Okay. Excuse me. So this is just an example of what it looks like when we're doing the treatment. This handpiece or a similar handpiece, depending on the laser, and the beam. The newer machines have a green aiming beam, which is a little bit easier to see, quite a bit easier to see. And the soft palate area in this photograph. So again, no pain, no redness, no swelling. Patient's pretty comfortable. They just feel some warmth. So this is a little video that shows a little bit of the Nightlase protocol. Say, ah. Say again. One more time. And this is basically just the same thing with the light on. So we're going to move forward with that. Okay, so basically we have the patient phonate in order to raise the soft palate to get better access to the tissue. But you can see, and typically we use high-speed suction in order to cool the tissue down. We didn't in the video just because it kind of interferes with the video. But the patient was still comfortable and able to have the treatment done. So just these are a couple of case studies. On the left is the before, on the right is the after. Same patient, you can see. We do the Mallampati classifications before and after. We document them with photographs. And the soft palate and the uvula raised up and moved posteriorly in a lot of cases. So you can see more of the airway is open on this first case. There's another case study, a little more significant opening on this patient from a class 4 Mallampati, all the way open. His uvula is pretty much tucked up in there, but quite a significant improvement in the tissue.
How many treatments was that, Harvey?
These are after 3 treatments.
After 3 treatments, okay.
And these photographs actually were pre-smooth mode. So actually the results are even better with the smooth mode. You get even more shrinkage. Here's another case before and after. You see significant opening in the airway. Same positioning, same patient, and this is typically what we'll see from before and after. Any questions so far on the Nightlase? Everything was pretty
that?
Could you repeat that, please?
Does medical insurance pay for that?
Right now, no. No, my office staff has been working for the last couple of months or more to try and get coverage through medical insurance. So it would be through medical insurance, not through dental. And we're going to be presenting at the hopefully at the American Academy of Dental Sleep Medicine, and it's going to take a little while for us to get insurance approvals. It took several years to get approvals for mandibular advancement appliances, so we know this is going to take a little bit of time too. But it's something that will, down the line will definitely have coverage.
You charge?
Excuse me?
What do you charge?
Okay, the charge for the Nightlase treatment is $1,500 for the 3 treatments, and the follow-up afterwards. If the treatment will last anywhere from 6 to 12 months, and we've seen it last outwards of 18 months, but we typically tell our patients 6 to 12 months, and we equate that to a patient going and having Botox or fillers done, where they're typically told they've got about a 6-month lifespan to that treatment. So this will last anywhere from 6 months to 12. Excuse me. What'll happen is the sleep partner won't let them get back to where they were initially. They'll never let them get back to that decibel level, and it seems that they really don't. So as soon as it starts to get any worse, they'll typically come back in for a touch-up, and we charge them $500 for a touch-up. which depending on the change will either be one treatment or more. So up until now, most of our patients have had one touch-up treatment anywhere from 6 to 18 months. So it is what's considered an evergreen procedure, which means it's a reoccurring profit center, like your hygiene department in the office, that if these patients want to continue with it, they'll be back. And we get quite a few patients come from outside of our practice, and a significant number of them end up staying as patients of record with us once they've come in for the treatment. Okay. Any other questions? Okay, so now we're going to move on to the Nightlase procedure. So in this anatomical drawing here, you can see facial muscles. So basically, we're interested in the buccinator muscles, the zygomaticus, the levator labii superior, in this area, the orbicularis oris muscles, and the depressor anguli oris and depressor labii inferioris. So they're basically the perioral muscles. Okay. So what is Nightlase? It's different. The Nightlase, if you remember seeing the photograph, we had a solid beam coming out of the handpiece. The Nightlase works differently. It uses fractionalized laser. Again, the erbium YAG laser, and it's for facial rejuvenation. So the fractional laser allows us to get collagen formation deeper into the tissue, which tightens up the facial tissues, smooths out wrinkles, tightens up the tissue. We get more vital-looking, facial tissue. The skin just is much more radiant and young-looking, and it also helps prevent wrinkle formation. And it's all done intraorally, so it's completely within the scope of practice in the entire United States as far as what you can do. From our research so far. So it's very natural looking. The patients are not going to look like they've had Botox. They're not going to look like they've had a facelift. So it's for your patient that wants that natural look, that wouldn't go and have a surgical procedure, but they want a rejuvenation. They want to look better. They want to feel better. And they don't want to get any injected materials into their body that aren't their own. So obviously, the more you can do with your laser, the better your return on investment is, and the better you pay it off, the faster you pay it off. So that's always good for any technology that we incorporate into our practice. So again, it prevents wrinkles by maintaining tissue tone and younger collagen, and improves the elasticity of the tissues, and we'll discuss that a little bit more too. So when we say elasticity, we do a cheek pull test for all of our patients before and after. So we have them, just grab with their thumb and index finger and basically just do a pull, and we take a photograph with it. And then we do that before and after treatment, and there's significant improvements with that. Let's go back one. Now, obviously, this patient has very deep-seated wrinkles. She was in our clinical study. We use her for our demos when we teach the course in South Florida. So she's had the treatment over the last 2 years. And her wrinkles have actually smoothed out. Her tissue tone is significantly improved. And her husband actually told her that she's getting less wrinkles. So that's part of what we see with our patient. So again, as compared to alternative treatments like laser peels or abrasion treatments, there's no downtime, there's no redness, there's no anesthetic, there's no injection or topicals used. In most cases, the patients don't feel any discomfort, just some warmth, and they can immediately go back to what they were doing, whether it's work or play or whatever. They can combine it with fillers or Botox if the practice is doing that. In our practice, I don't condone the use of it, so it can be done in conjunction. If you have some very deep wrinkles, you may want to do a combination of the Nightlase with some fillers, for those patients.
Harvey, one thing that I would add is with our aesthetic lasers, our dermatologists, plastic surgeons, etc., they're using this same type of a procedure intraorally, and they are combining it with extraoral laser treatments, light laser pills, etc. So they're also doing this, but combining it with procedures done outside the mouth.
Yes, yes, absolutely correct. Yeah, but as dentists, obviously, we can't do that with patients. We can do it with family members, and friends, but we can't do that with, with paying patients. But that is being done, absolutely. And the combination of the two procedures together, the results have been amazing. So that's definitely an area too. So the tissue biology, the fractionalized laser, and the difference, the handpiece insert is different, and it breaks the beam up to about 100 mini beams, and we'll show you what that looks like. So you get a localized conversion of the tissue collagen, similar to what you get in Nightlase, but you get much more penetration. So again, we get a contraction of the tissue, increased tissue tone elasticity, more youthful appearance, softens the wrinkles in the facial lines, but just the vibrance of the tissue is totally different. And the patients they tell me they just look in the mirror and giggle when they look at themselves. They're just so happy with the difference. So again, the fractional laser treatment is non-ablative, which means there's no tissue being removed. So it tightens the skin, again, smooths light to medium wrinkles, improves tissue tone by improving elasticity, gives a more youthful appearance, and prevents the formation of wrinkles and the loss of tissue tone in the future as long as the treatment is continued. And we'll go through how long it lasts and everything too. So this is different types of laser treatment on the skin, very similar on the mucosa. Here to your left, you've got ablative resurfacing, typically done with CO2 lasers or erbium YAG, where several hundred microns of tissue are removed, okay? So the patient will have a lot of redness, a lot of swelling, significant discomfort, and obviously they'll be hiding for a couple of days and then go out with, heavy makeup or peeling, wrinkling skin. Another option is superficial fractional ablative resurfacing, which is also fractional, which means the beam is broken up, but there is tissue removed, okay, but very superficial. What Nightlase is non-ablative fractional resurfacing. So there is no tissue removed, and we get deep penetration into each of those little mini beams into the tissue. So we're affecting deep into the underlying tissues. And then you have ablative fractional resurfacing, where you have the little mini beams, but they're removing little columns of tissue deep into the tissue. And again, recuperation with that is significant too. So Nightlase is non-ablative fractional resurfacing. Very deep heat penetration to convert the collagen without removing any tissue. So this is what the fractal beam looks like coming out of the handpiece. So the beam is broken up. This is the older red beam. This is the green beam. So you can see it's broken up.
Can we get the red beam?
Excuse me?
Can we get the red beam rather than the green one?
Well, the new machines have the green beam, and the benefit to the green beam is it's more easily visible against the tissue. So when you're
red is better for healing.
Right, but that's just the aiming beam. That's not the energy that you're using, let's say with the ND YAG, for biostimulation. So that's just the aiming beam, which shows you the direction where the energy is going. So that's like a
I know
laser pointer.
that all of them have that.
The aiming beams?
Yeah.
Yes, they do. But the aiming beam does not have significant energy to do anything therapeutic. So the aiming beam is like a laser pointer. that you would use, if we were giving a class and pointing at a screen. So it's not a therapeutic.
Most of the red beams are positive and good for the tissues. A lot of the green ones are not.
Correct, but the aiming beam is such low energy that it's not therapeutic, whether it's red or green. In these lasers, right? It's just an aiming beam to show you where your energy is going.
Yes, I know what it is.
Okay, all right. So I mean, it doesn't really make a difference. Keith, I don't know if the red beams are available anymore.
No, everything is green now. Is that Dr. Jones?
Yes.
Yeah, the reason we did that was, like Dr. Shiffman said, is the visibility is so much better whether you're on cutting teeth or you're using it in soft tissue or in bone. And the green aiming beam also doesn't get lost if you have a headlamp or something like that also. So people that use this green aiming beam love it compared to the red. And as Harvey also said, it's not doing anything therapeutically. All it is as you well know, as your experience, all it's doing is giving you a direction, and it's not doesn't have any kind of an impact clinically at all.
I can talk to you later.
Okay.
All right. I've used both. I have both machines in my office, and the green beam is significantly easier to use, like Keith mentioned. In operative procedures, soft tissue procedures. So it's and I use a microscope, and I have loops with a headlamp, and you can definitely see it better. So this video is going to give you an example of smooth layers, and I think this one shows the new smooth mode. So if you listen carefully, you'll hear the bursts of the smooth mode. Now, if you notice, there was a slight pattern on the inner lip there on the mucosa, and that's typically what we'll see. And as soon as it's just from dehydration, not ablation, there's no tissue removed. And as soon as the patient licks their lip, the marking is gone. It helps us see where we've been as we move from spot to spot. So each one of those bursts that you heard was 6 pulses within that 1.5 seconds. And typically we'll use high-speed evacuation to cool the area. Again, it wasn't used here just for the sake of the video, but again, the patient was very comfortable. There was no topical or any injected anesthesia used. So here's some cases on the left before. The patient's concern here was the nasolabial fold lines. And here's the after. You can see we've significantly smoothed those. Okay. Here's some other case studies. This is from presented research. So again, with the nasolabial fold lines before and after. You can see the significant reduction in that.
Yeah, that's impressive.
And these are the results that we see typically. Here's another one. Obviously, there's a gentleman in here, just to show that we're not sexist. Works on men and women. All right. Now, this is the before and the after. And in this case, the after was taken immediately after the first treatment was done. So you can see the resolution of the creases immediately. So we do see immediate improvements, after each treatment that we do. Now, we had one patient that was in our clinical study, and she'd been a patient for several years, and I'd done some restorative, some crown and bridge on her, and it was always easy to place the mirror in and stretch her cheek all the way out and get 2 hands and a foot in there. And the first time that she had the need for restorative treatment after she had her smooth lays done, I put the mirror in and I went to stretch her cheek out, and it only went out, about an inch or so where it would have been a 20, 30-year-old, and she was in her upper 70s. And she was just hysterical laughing because she knew that her tissue had been so youthful after the treatment that we couldn't just stretch her out anymore. So the patients really, really appreciate this treatment. So here's another before and after. Okay, pretty deep lines. And there's the after where the lines are resolved. Pretty deep wrinkles. The nasolabial fold too. So again, depending on the depth of the patient's vestibule, we can treat the infraorbital area, get some resolution and puffiness in the lower lid area, if the patient's got a high enough vestibule, and then we can go all the way down to the jowls, typically at the border of the mandible. We can get resolution of some of this jowliness too. Again, depending on the depth of the patient's vestibule. All right, very, very important is that the patients have reasonable expectations. The photograph of this woman, she's called the cat woman, and supposedly she's had more plastic surgery procedures than anybody in the United States at this time. We usually discuss Joan Rivers, and right now out of respect, I guess, but this woman's had more surgery procedures than Joan Rivers had. So again, reasonable expectations. It's important to let the patient know what you can and cannot do with this procedure, and it can be combined with fillers, and it's going to give them a more youthful tissue tone and appearance, but it is not the type of appearance that they're going to see with a facelift or Botox. All right, their lips and cheeks and everything are going to be able to move, and they're not going to look, like they've been tightened up in a wind tunnel. So very realistic expectations.
How long does it last?
Typically, it'll last similar to the Nightlase, anywhere from 6 to 18 months. We tell our patients 6 to 12 months, and then again they come back for follow-ups. The difference in the treatment planning is it's age-related. So if the patient is 50, then we recommend 5 treatments, 66 treatments, and on up in order to get the optimal results. So we base that basically about $500 per treatment, and we treatment plan an entire package. So a 50-year-old would be $2,500 for the treatment, just to give you an example. But you want to do that minimum age-related to get the best results. And again, follow-ups typically anywhere from 6 to 12 months, would be approximately $500. The cost of Botox or Restylane or any other fillers is, for the amount of coverage that we get, is significantly higher. So for that patient that appreciates the cost in that type of treatment, and we always relate it back to that too, it's fairly reasonable. Now this photograph shows before on the left and after on the right of collagen density. These studies were done, biopsy studies before and after the smooth lays treatment. So you can see significant changes in collagen density, and that's what causes the tightening and the firming of the tissue. So treatment expectations. For Nightlase, the patients, like I said, we treatment plan them for the entire package of treatment to get the optimal results. We frown on people that just want to have the patient do one treatment and then make a decision, because if they don't do all 3, then they're not going to get the results that they could get. All right, so the timing is typically now 21 days apart to allow for the collagen conversion, and again, it'll last anywhere from 6 to 18 months. It's definitely going to vary. We do tell our patients from 6 to 12 months, on the low side. just to be safe. And with smooth lays, again, like we discussed, one treatment per 10 years of the patient's age for optimum results. Same thing, 21 days apart. 6 to 18 months, again, depending on the patient's age. If they're a smoker, if they've, significant sun worshiper, or they've got bad diets, obviously it's not going to last as long. So a little bit of counseling goes along with it, with the Nightlase and the smooth lays, for the best results. And then we're done. Any questions with that?
Yeah.